Patient Ryan, time for some palpations. ASIS.
Oh yeah.
Right there. I found it. Ooh, wow. Sartorius, that will wrap around there. Okay. Rectus femoris, that teardrop femoral muscle. Can you like zoom back a little bit more? Thanks, biggest bro. Here, we'll make it go this way. Okay. Then we have the vastus lateralis outside, vastus medialis, and vastus intermedius. And we got the adductors. These bad boys in here. They're sore. He just had a game. BSIS, turn around. We have his BSIS right here. What's up, Matt? What's up? We have glute maximus. There. We have this ischial tuberosity. That's around here. We have hamstrings.
Just a couple minutes.
Hamstrings.
Oh, those are sore.
Sole hamstrings.
Oh, I feel leathers. Leathers are not there, you know.
Iliac crest. Right there. Tensor fasciata.
Holy.
Right in there. We got his glute medius. Right here. Yeah. Greater trochanter. Turn around. That'll be this bone right here. And then the IT band along the side of the leg. Oh, side. Yeah.
Shit.
Hey.
Nico! We're gonna do some palpations. The ASIS in here. Sartorius in here. Vastus lateralis is teardrop in
Lateralis.
lateralis, my bad, right here. Vastus medialis in here, and vastus intermedius in between. Your adductors inside
Oh
here.
my gosh!
PSIS. Back. Hits right here. Glute maximus in here. Ischial tuberosity. It's under the butt. There's like the bony in there.
I did it wrong.
Yeah, he did it wrong, so we figured it out.
Figured it out.
Yeah, these are the hamstrings. Iliac crest. Right in here. Tensor fasciata. That's on the side down. In here. Gluteus medius. A little underneath. Above the max, actually. Greater trochanter. It's the bone. Right in here. And then the IT band is down along here. Yup.
Okay, so now for some pelvis palpations. So we got ASIS again here. Right there. And then we got the umbilicus. Where's that? Right there.
Okay, yeah. Jesus.
Belly button. Okay, McBrain's point. Right side of his body. In between. Testing. Appendicitis there. And then SI joint. It'll be like central. Just about into these joints. These two joints right here. SI joints.
We're gonna do the ASIS again. It's right in here. And then the umbilicus. Big Barney's point is along the line down here.
Oh!
This is appendicitis. And then SI back. It's in between the little dimple points in between the back. Come on.
Action. Okay. We're gonna be doing hip scouring. Looking for some labral pathology here. We're gonna flex this knee here, and we're gonna we're gonna move it in some rotations. He's doing quite well.
We're gonna do some hip scouring on each right here. So we're just gonna flex his knee up and just kind of move it around, see if anything seems off or he doesn't have some movement. But he looks pretty good. Feel good, bro? Okay, there we go.
This is the torque test on the hip, so we're gonna have him press his leg, and we're just gonna like push down. Any pain?
No.
No pain means no femur fracture.
In the torque test, we're gonna put his leg out here and then put pain or like pressure on his hip, kind of just push it down. Any pain with that? No. No pain means no fracture.
Alright, this is the 90-90 test. Testing for some hamstring tightness, so just lift your right leg up or left leg. Alright, next leg. Okay.
Just to clarify, we had a game. So.
We're pretty tight. Hey guys, so we're gonna have Shinji here cross his right leg over his right or left knee. Okay, and we're gonna push down on his right knee and make sure that this left hip isn't coming up. And if he had pain in this, then his SI joint would have some sort of pathology that we need to look into. Which he's good, yeah? That's fine.
For test on Nico, as we saw in class, it's pretty bad. We'll put his right leg over his left, spike it up, and tell the patient to put it down as far as he can. Wow, look at that. Doesn't go down. Hold this side. Hold this side, push down his pelvis, and the patient should be down here. How does that feel?
Ow.
That means that there's something wrong with his SI joints.
Whoa.
So,
there's nothing wrong with me. We're going to be testing some more SI joint. These bad boys here. Alright, so Shinji, stand on your left leg for me. Bring that right knee up high. Okay. Pretty decent. It's not tilting. Maybe try the other leg. Ooh. Well, we can see that his glute medius, and hips are pretty strong because there's no severe dipping in the SI joint area. I'm going to top chop off.
Do the Trendelenburg's test. A positive test would be that his pelvis would drop, and we're looking at his SI joints back here. So can you stand on your left leg for me? Put your right knee up high. As you can see, his body tilts a little bit to the right, spikes up to the right. Can we see your left side? And this one's not as bad, so we can see that his right side has to give a little more when he stands on his left foot. So I would say it's a somewhat positive test.
Well there. Okay. We're gonna be testing for a tight IT band right here. Alright? Yeah. So we're gonna pull this leg. We're gonna kind of go opposite directions here. Take a bend, sister. How's this feel? Pretty tight. Yep. I imagine you had a pretty hard soccer game this weekend, don't you? I would say that this test was positive for sure. Some would say that he has the tightest IT band that they've ever seen. Shout out.
God did.
Shout out Will. Shout out Will.
Mm-hmm. We're going to be doing the over test to see if his IT band is tight. So I'm going to grab it like this. And the thing is, I'm going to make him go relax. And if this drops, I mean he isn't tight. But if it stays up, then he is. And as you can see, it's not really dropping. So that kind of shows me that this boy is tight. He'd be tight as a mug.
Follow me. Alright, we're going to be testing his piriformis. Alright, piriformis will go down in the butt cheeks. Alright, so we're going to have you lay here. And I'm going to have you slightly overlap your knee. I'm going to go like this. Push down and pull back. Any butt cheek thing? Nope. Nothing. Nope. Stretching it. That's good. No piriformis syndrome. Come on, give me that.
Is it going?
Yeah.
Alright, we're doing the piriformis test. Follow me. That way. Okay. Okay. We're gonna have his legs bent. Put this one a little over the other one. And apply pressure here, and also torque the back in, and see if any pain happens in his butt.
Yeah.
Okay. He's chilling. Straight chilling. I'm ready.
Alright, so he's going to lean back and grab his right leg. I'll support you, biggest bro. Alright. Okay. Get on the back! Get on it. Okay. Well, as we can see, his hip is in pretty 90 flexion. It needs to be more extension, you know, so that means his hips are tight. And then the quadriceps are a little tight. We want this angle to be a little bit more like that. You getting a good stretch in there?
Oh yeah.
Keep it up, brother. Keep it up.
Come on.
One day, you're gonna be really loose.
Yo, Thomas, this is your test. Alright. He's ready to get into it. Yeah, lean back. As you can see, this is supposed to be at 90 degrees, and it's coming up a little bit. So I know his hip is, my bad, 45 degrees. His hip is a little tight, so it's popping up a little bit. And his leg, so it shows me his quads are a little tight, because it's supposed to be like that. How does that feel? That's all you need to know. There you go. So he tight.
Alright, so Shinji has reset his spawn point. He's gone to his bed. And we're gonna test if his leg length is the same. Alright? So we'll have you go here. Thank you. And if I had to take measure, I would measure from twice. I would measure from his umbilicus to his medial or his lateral malleolus. No, that's medial malleolus actually. And then I would do another test to do his greater trochanter, I think. No, ASIS to lateral malleolus, and I'd see the difference. And if there was, then he'd have some unstable pelvis.
And I do the same on him. If he was in my position, I would do the same measurements.
He would do that. I got you. Whoa. I like your got Shinji here in fetal position. We're gonna be doing the gapping compression test, testing pain in the SI joints or the glutes. Alright? So basically, do less fetal with the legs. Perfect. You're gonna find the gap, alright? In between like basically just push on like tensor fascia lata, and you should like compress them into the ground. And if there's pain, is there? No? Alright. That's good. Sweet.
We're gonna put Nico here in the fetal position. He's in pretty much fetal position. I'm gonna put pressure near the tensor fascia lata, and I'm gonna just push down into the joint. Is there any pain there?
No.
If there was pain though, that means that the SI or glute is hurting or is tight. Go whip of match foot there.
Long sit test.
Line up the heels. They're good. They're even. Sit up for me.
The left leg has grown to be a little longer, which means that he's got a little rotated posterior ilium. His ilium rotates posteriorly. So,
Yeah.
wait.
Nice dude. Long sit test. Gotta put his heels together. Looking good. Alright, can you sit up for me? Wow. It looked good. You got nothing. Be perfect.
So, McBurney's test. I'm gonna palpate. Hey, I'm the doctor here. I'm gonna palpate right here at McBurney's point. I'm gonna go in. And if he has pain when I let go with the rebound, he has appendicitis. That was anticlimactic.
Alright, same with him. We'll put pressure right here. And if there's pain when it rebounds, he has appendicitis.
I'm kidding. Oh, wait. Good one, Nico.